Hello and welcome to another episode. So I have with me Professor Sukumar. Professor Sukumar has been educated in US and has worked in India, US, Germany. He's moved from quantum chemistry to computational chemistry and medicinal chemistry. He works with a lot of life scientists, various biologists, various chemists. He's worked on various disease areas, and I've been privileged to just begin to start. We've just started to have some collaboration, and I had a great privilege to publish his book. The reason I'm very excited about this book is that it's a book for industry, it's a book for students, it's a book for well-established professors. It's for sort of everyone to understand what is the whole watershed movement going on in a major industry. Drug discovery is several trillion dollar industry, bigger than even economy of a country like India, large economy. So globally, it's one of the major human endeavors that we're going through. And what Professor Sukumar's book has done wonderfully in rather, it's not a exceedingly long book. We're talking of 100, pages. So it can be read in 2 days. For a for a newcomer, for somebody from pharma drug discovery background like me, it's a 3 hour, 4 hour sitting that you can go through the book. But it's a great summary. In some ways, I actually equated it to, I was talking to my colleague and I was equating it to a wonderful review, which was like Hallmarks of Cancer, which was cited some insane 40,000 times, because it basically took a very complex topic and put it in some 20 pages. What Professor Sukumar has done has taken this watershed movement of drug discovery and succinctly summarized it from prehistory history of how medicines were found all the way to what is the cutting edge in roughly 100 pages for you in a very nuanced way. He's not, he's not oversimplified anything and put what are the new horizons to be conquered. So it's great. Now, actually, I'll request Professor Sukumar. First of all, welcome, Professor
Thank you.
Sukumar. I'll request him to describe, before we get to AI and maybe another episode, or computational biology. Uh, I'll request him to describe what is the way drug discovery was done and is still being done in most places. So, what is conventional drug discovery?
Yeah. So, uh, conventional drug discovery basically starts with uh, either you have a target or a molecule. Uh, so, a target basically is a protein in the body, and a molecule will be a potential drug which you hope will uh, will bind to that target, and that target has a role in the disease. So,
Mm-hmm.
uh, so, uh, so when you so the first stage would be identification of the target, and then um, screening a large number of molecules, uh, and in order to get some molecules which may show some kind of activity
Mm-hmm.
against the target.
Mm-hmm.
Then the next stage would be the heat to lead optimization. So you
Mm-hmm.
take um, the new chemical entity
Mm-hmm.
and improve its potency, and then uh, you know improve its selectivity to the target and
Mm-hmm.
so forth. And then and much of this is basically done in academic research labs.
Mm-hmm.
Uh, in the later stages of discovery, where you have uh, animal testing, where you have human testing, these are uh, primarily done in hospitals and in pharmaceutical companies. And these are much more expensive
Mm-hmm.
endeavors,
Mm-hmm.
because even if you have, let's say, a small clinical trial where you need to follow a few dozen patients,
Mm-hmm.
but you need to monitor them, you need to follow them, you need to make sure that they are
Mm-hmm.
following the regimen. Whereas
Mm-hmm.
the earlier stages of drug discovery, they are done in an academic lab and they are much cheaper.
Yeah.
But there is a huge
Mm-hmm.
amount of failure which goes uh, you know, uh, along the pipeline. So you might start out with screening 1,000 molecules, and then by the time you get to the clinical trials, you'll be lucky to have one.
Yeah.
So, and and so here is where I'm jumping the gun a little, but here's where you want to be able to shift that process that so that if you're going to fail, if a molecule is going to fail, you want to know it as early as you can.
Yeah.
You don't want to put in $1 billion of investment, 9, 10, 12 years of research, and then have the molecule fail in the last stage. That is a disaster. That is a complete disaster, both for the industry as well as for the patients who are depending on it. If you have 100 molecules fail in the first year, that's not a big problem. So what we want to do is try to shift that balance.
Yeah. So you described the whole thing really well. Couldn't have been done better. But I would like to point out an interesting nuance before we call it. So a biologist who does the drug discovery would have focused on saying model system based screening. You started with molecules. From chemistry side, I started from life sciences and I learned chemistry for drug discovery. You started from chemistry and you learned life sciences. So that kind of,
Yes, again, even with the molecule, are you going to start with the drug molecule? Or are you going to start with the biological molecule in the body, the protein? So again, there are those two things. Yeah. But the key thing that we are trying to do is to do the fail safe, fail cheap.
Yeah, exactly. And that's where computational biology and AI becomes very relevant, and we'll discuss that in the next episode. Thank you very much.
Thank you.